Hi, I'm Dr. Sreelatha, working as a fertility specialist in Dubai. Today, I would be talking about a topic which is very sensitive and emotional at the same time. It's called the recurrent pregnancy loss, or in layman's term, repeated miscarriages. At medical school, when they teach us the definition of recurrent pregnancy loss, it goes like this: two or more miscarriages, and then we start investigating. But I often ask myself, do I have to let my women suffer another miscarriage before I actually start investigating? Because every time a miscarriage happens, it is the loss of a loss of a dream unfulfilled. You have nothing to show for after being pregnant. Most couples tend to grieve in silence within the confines of their home. Why do miscarriages happen? The most common answer that we always hear is chromosomal abnormalities. But apart from there, we do have autoimmune conditions, infections, inflammatory markers, metabolic disturbances, which include thyroid disorders. It also includes pre-diabetic conditions. It includes lifestyle choices, example, smoking, alcohol. It also, I always tell my women that, stress also does play a role. So high stressful conditions, infections, sperm parameters, which include sperm DNA fragmentation, are some of the factors that contribute to miscarriages. I would like to reassure all the women that it is important that you understand that most of the times, or almost all the time, the miscarriage is usually not your fault. What it really requires of the women who are going through this is to actually start asking questions, seek the answers, understand them, go through the testings that are actually prescribed. Once you have the answers, start implementing them. I would like to tell my couples that this might even involve a multidisciplinary approach in our mission to seek answers. An immunologist, sometimes an endocrinologist is also required to help us understand why we are going through what we are going through. Getting support emotionally and mentally is something I always tell women, because it's not easy, both physically and emotionally, once you've had a miscarriage, to bounce back. Seek help when you can and when you need. Seek answers always when you've had a miscarriage, and then look forward with hope so that together we can have your dreams fulfilled. Thank you.